And joining me now is Troy Wells. He is Baptist Health CEO. It is always good to catch up with him. And Troy, thank you very much for being with us on this cold winter week.
Thank you. It's great to be with you.
You guys are celebrating a pretty impressive milestone as an organization, as a business entity, 100 years this year. Tell me a little bit about the origins of Baptist Health and just the significance of being around for a 100-year anniversary.
Thank you, Roby, and we're glad to be here to be able to talk about it. In 1921, what became Baptist Health was incorporated in Pulaski County, and it actually started the year before. The Baptist State Convention acquired some property in downtown Little Rock in the fall of 1920, and part of that property had the Little Rock Sanitarium, and it had equipment and everything where they could take care of patients. So they began the hospital actually the year before, but on February 16th of 21, that was our incorporation date. And so we recognize that as our birthday. And so just this week, we did celebrate 100 years of Baptist Health in Arkansas. And what started as a small building that could hold 75 patients in downtown Little Rock has become a health system that stretches across the state, 11 hospitals and hundreds of physician clinics and therapy centers, and serving tens and thousands of Arkansans every day. And it's been quite an interesting story to follow for the past 100 years.
Take me back to some of the early days. I'm sure you've looked at some of the history on this. Kind of what was maybe one or two of the really big pivotal moments for Baptist Health? I would think that building that campus right there where you're at right now in I want to say the 70s, if I recall correctly. I might be wrong on that, but that had to be one of the major monumental milestones there. What are some things that you've looked at when you've reviewed the history?
Lots of interesting history. The 60s were an interesting period because that's when the convention separated from the hospital and we became a private 501c3 organization. So that was really important in our history when that occurred. And it didn't happen overnight. It took many years of debate and conversation in order for that to occur. But you're correct. 1974, when the hospital campus here in Little Rock was rebuilt and opened, was probably one of the most significant parts of our history, given the location. And back then, you had to take a gravel road to get to the hospital campus. And a lot of people thought that we were crazy, but we had some really smart people in the organization back then that anticipated and had a sense of where Little Rock and the interstate system was going to evolve and how important it would be to have a major medical center right at the intersection of what's now 630 and 430. And of course, that really has played an important part of creating easy access for Arkansans to get to the state's largest hospital.
And I will show my age here. I mean, I know I look young and everything with all the gray on the sides there, but I actually remember all of that because I was a kid that grew up in that end of West Little Rock. I remember those gravel roads and riding bikes to what would be kind of the basin, the bottom of where Baptist is built up on those hills as that interstate was being constructed. But for anybody watching, I'm still in my, I'm still under 50, let's just say. So
well,
I'm going to pretend.
Yeah,
I'm going to
right.
pretend. I'm going to pretend. So
you're looking great. Well, the other thing too, if you think about it, when we rebuilt the Spring Hill campus in North Little Rock, that's been around for 20 years now. And it seems like it was built just yesterday. But again, located at an intersection of the Interstate 167 and Interstate 40. And then of course we built our Conway campus on I-40. And so we've had good success creating really good access for people of Arkansas.
And you guys have been in the Fort Smith metro area for a couple of years now with an acquisition up there. Tell me how that integration has gone, and maybe, you've had COVID-19 and obviously, of late, some pretty nasty weather here, but tell me how that transition has gone.
It's gone really well. Not to say that we didn't have challenges. Anytime you take that large of an organization and try to merge it into another large organization, you're going to have challenges. And things you don't foresee and anticipate, but we've worked through that with their team out west and our team here in Central Arkansas, and they've done a great job. I'm really, really happy with the team that's out west, the caregivers, the physicians, the nurses, the staff. They have done a tremendous job responding to COVID-19. They have meshed well with the rest of the health system. It's just been a wonderful transition. Great group of people, and we're so excited to have been able to extend our footprint into Western Arkansas.
So, I mean, it begs the question, is there more extension of your footprint potentially in the future?
Well, I don't know that that's part of our plans. I think that we're very comfortable being a regional health system. I think we're a good size. We cover a good geography. The West Addition really was a good fit for us. But we never say never, but we're not aggressively looking to expand necessarily.
All right, let's talk about COVID-19. This has obviously been the healthcare story of the last 12 months, maybe a little bit longer. The last time you and I sat down and talked, we were kind of in the really kind of late summer, mid part of it right there. We hadn't seen some of the late year spikes that we have seen. Just maybe give me an update of where you feel either optimistically and or pessimistically about how we're addressing COVID-19 as a country and as a state.
You're right. A lot has changed since you and I sat down last. We experienced quite a bit of pressure in December, January, and the first part of February. But since then, it's been a dramatic decline in COVID-19 hospitalizations in Arkansas. And I know you track the numbers and you see what's going on. Our hospitals, however, are still very busy. Critical care capacity is still tight. It's just not, it doesn't have the same amount of pressure from COVID-19 that it had 30 days ago. We talked all along throughout the pandemic about how there were shortages of critical care beds in Arkansas, and that we're used to dealing with high census in those areas across the state. So that continues with or without COVID. But we are at least seeing some relief in those COVID hospitalizations. That's great news. Vaccine, really, really important. If there's one message I'd have for the public, it's be ready when it's your turn to get the COVID-19 vaccine. This is what can take us out of this. And without the vaccine and without uptake of the vaccine, there's a possibility of another surge like we saw back in the winter. So there's no guarantee that this goes away unless people receive the vaccine. And so it's gone a little slower than we'd hoped. We're not getting as much vaccine into the state as we would like, of course. But the healthcare providers, the pharmacists across the state are doing everything they can to get every vaccine given in the week they receive it. And so far, Arkansas has done a pretty good job. And I would say that the way we've coordinated this statewide, both back during the height of the pandemic when it came to bed management, patient management, and now with vaccine distribution, we have taken a very centralized approach to managing the pandemic. And actually it goes back to last spring when we looked at, statewide, how we're going to handle closures and restrictions and all those kind of things. That's not been easy at times, but I would say that I talked to a lot of other leaders in other states who don't have a centralized approach, and it's been really chaotic and a lot of unhappy folks. And so I think that our state has done a really good job of staying together and working through these challenges together. And now with the vaccine distribution, again, we're taking a statewide approach in how we do that.
More for the general viewer here, if you think that you need some sort of healthcare attention, is there anything that restricts you from doing that now? We went through that period where your hospital was a ghost town because we were being so careful about letting people in. Is there anything that people should be worried about coming to a hospital setting?
No, not at all. The hospitals have stood ready to care for whatever needs are out there. We still are doing some visitation restriction. We're trying to keep the number of people in and out of the facility at a minimum if possible. We do have to make exceptions from time to time given a certain clinical situation. But no, the public shouldn't have any hesitancy to come to their hospital locally or wherever they are across the state. We're not restricting services. There was a time where certain hospitals had to cut back maybe on some elective cases to free up some staff to provide care in critical care areas. That's probably gone away by now. I suspect that most have been able to go back to their full slate of services. I think, but in January, early February, there were some challenges with staff, but I think that's probably been resolved now that the COVID numbers have come back down.
All right, he's Troy Wells. He's the CEO of Baptist Health System. It is always good to catch up with him. I have a feeling, again, happy 100th birthday, anniversary, however you want to do that. I have a feeling, knowing the folks on your staff, that just that one time, one date is not going to be the end of what we hear of 100 years of Baptist Health being around.
Yeah, it won't be the end of it. And we did make a conscious decision not to do the huge celebration right now in the midst of the pandemic. We wanted to wait, let that subside. Hopefully things will normalize throughout the year, but it will be a year-long celebration, so there'll be a lot more to come.
All right. Congratulations to you and everybody associated with the organization. And thank you for your time, Troy.
Thank you, Roby.